name is Mike Fumo. Graduated in 2007 with my partner, Dr. Keithan Badani. And this is going to be, I guess, kind of a summary of a lot of things that we've talked about here today. And it's 5 easy steps, 6 slides, and we'll go and enjoy the rest of our day. I am currently in private practice in Northern Illinois at Rockford Urological Associates, and I'm also a clinical assistant professor at the University of Illinois College of Medicine at Rockford, and the director of the urology program there. The first thing, and this strikes me now being in private practice, I think very clearly, and it also goes with kind of my entire viewpoint of how I view patients, is not that they're necessarily customers, but that they come to us with expectations. It is our job to take excellent care of them, but for the entire procedure and everything around it, from our support staff to their lodging. And Dr. Menden made this entire experience. Dr. Barry's talk today, I think, really talked about how it was an experience and how the patient views it from that point. I think it's very important for us as caregivers to remember that. And that's just something that strikes very sharp in my mind. And every patient, of course, expects a trifecta outcome, and I work really hard, as we all do, to give reasonable expectations, but at the same time to always give them hope for solutions if those expectations aren't met. As we all know about the papers talking about patients being unhappy with outcomes after robotic surgery, but I think in general that I haven't seen that same thing to be true. The one thing that is one pet peeve of mine always is the amount of time we spend trying to set up these expectations, but our customers and patients always forget 75% of what we say within a day, and this has been shown in multiple studies over and over again. So we have to give them plenty of education and literature to help remind them of what their expectations should be. Most importantly, which I've tried to bring with me to Rockford, is that this is a team approach, and from the very beginning it's been a structured education from myself, my team there. The team approach not only starts in the operating room, but the entire hospital to the post-op floor. To my left right here is Brad Bays, who is one of the head nurses back in Detroit, and I try to have cloned him back with me in Rockford, but that can't happen, but at least I've brought his knowledge and I've shared it with others there to try and have my patients benefit from the same things. That teamwork really benefits the patient immensely. Robotics is much easier on the patient and thus for us, and being the lazy person that I am, I like it easy and I like my patients doing well. So looking at Medicare data, Beganol looked at the risk of complications, all complications in patients after open radical prostatectomy, and that was between 25 and 30% in patients. And then Dr. Bandari, my junior resident, who's now junior staff at Ford, with Dr. Menon, looked at the complications in Detroit, and with robotic prostatectomy, it's much less. And I think we can all agree that we see that in our patients. It's amazing seeing people get up and giving grand rounds the day after surgery. It's a privilege to be a part of such a thing. I feel lucky to have to learn this technique and be able to share my skills with my patients. And this is the thing that I think has stuck with me the most. We've talked a lot about apical dissection today, and this has particularly been reinforced now to me being in practice and having long-term follow-up with my patients, and how important it is for potency and continence to really take care of the apex of the prostate and get into the correct plane, not only for cancer control, but also just for their overall functional outcome. And just the preservation of the periurethral tissue, as well as not disturbing the rectourethralis muscle. Then lastly, Dr. Menon's dream and tenacity changed the face of urology, and I think that mixture of being able to dream and at the same time be tenacious is something I try to strive for. I don't have the same ability to dream as Dr. Menon does, but I hope that I can at least reproduce his tenacity a little bit. As far as the people in my life who have seen this type of tenacity, and there's only 2. And one is my father, and the other one is Dr. Menon. So that's the highest praise that I can give him. That I want to thank him. I think, as we all do, for allowing us to be a part of that tenacious personality and dream of making things better for our patients and for the world in general. So that's all I have as far as the talks go.